The purpose of this demonstration video is to highlight the main features of the Sara Plus Active Lift. Sara Plus is a standing and raising aid for short transfers of residents and patients, including raising to standing from the side of the bed and transfer to chairs, or from wheelchair to toilet. This equipment is also suitable for rehab exercises, including walking training, when the footboard and knee pad are removed. Transfers with the Sara Plus can be made indoors, in the patient's or patient's room, treatment rooms, in communal areas, or in a bathroom. The Sara Plus is intended to be used in hospitals, nursing homes, or other healthcare facilities for different categories of patients. The Sara Plus must always be handled by a trained caregiver, continuously attending to the patient and in accordance with the instructions outlined in the Instructions for Use, IFU. The Sara Plus is intended to be used with specifically designed Arjo slings. Patient assessment. Before attempting to use Sara Plus, a full clinical assessment of the patient condition and suitability must be carried out by a qualified person. The Sara Plus is suitable for multiple therapy uses, including, but not limited to, patient transfers, walking practice or gait training, rehabilitation activities including supporting core strength development, sitting and standing balance, seated on the edge of the bed activities. Sara Plus features. The arc rest with hand grips is an integral part of the lifting mechanism of the lift. The intuitive and supportive armrests allow patient participation and comfort during the lifting procedure. The foot support is used for positioning the patient's feet when lifting and transporting. The foot support can be removed if using the Sara Plus as a walking aid. Removing the foot support. Position yourself between the chassis legs and grip both sides of the foot support. Pull the foot support towards yourself until it is clear of the support bracket. Slide the foot support cover back down into position and secure using the hook and loop strap. Refit the foot support by reversing the procedure. Proactive pad. The proactive pad is a reactive lower leg support which enables the patient to be lifted comfortably and effortlessly. It can be adjusted vertically for differing lower leg lengths and is sprung to stay in contact when the patient's legs move during the lifting procedure. To adjust the proactive pad, hold the proactive pad with one hand and slacken the clamping screw knob with the other hand. When the correct height has been established, retighten the knob. It can be removed from its mount quickly. For walking practice, simply by lifting upwards after the foot support has been removed. Adjustable width chassis legs. By operating the appropriate button on either the hand control or dual control panel on the lift, the chassis legs can be opened to any variable width. When pressure is released from the button, movement stops, and the chassis legs remain securely in position. Scale. If your Sara Plus has been supplied with the integral scale unit, it is possible to weigh a patient during the lifting procedure. Transferring a patient. The caregiver must be positioned behind the Sara Plus during the transfer. Select and apply the sling according to respective sling IFU. Approach the patient from the front with the lift. Stop before the foot support and proactive pad are in contact with the patient. When the patient is ready, have the patient place their feet on the foot support, pushing the Sara Plus towards the patient a little to achieve this easily. Adjust the proactive pad height if necessary. Align the top of the proactive pad just below the patient's patella or higher based on patient comfort. Carefully push the lift closer to make full lower leg contact with the proactive pad. Apply the chassis brakes. For walking, remove the foot support from the lift and store carefully for future use. The proactive pad can also be removed to increase the gait, but should be replaced prior to sitting down. Attaching the Sara Plus sling to the arc rest. Take each attachment cord in turn and attach to the sling by pulling the cord through the sling loop and locking the attachment cords into the cord retaining cleats. When both cords are attached correctly, tighten them so that any slack is taken up in each cord and the back section of the sling supports the patient comfortably and securely. If possible, the patient should hold on to the arc rest with one or both hands. If the patient is able to offer some assistance when standing, this may be beneficial to patient confidence and muscular exercise. Encourage the patient to assist all they can to raise from the chair and steady themselves. Apply the brakes to the Sara Plus. Check that the attachment cords are fully in position and locked before commencement of the lifting cycle. Operate the lift button on the handset or dual control panel to raise the patient to a suitable and comfortable height. Tighten the cords once more if necessary once the patient's weight is taken up. Release the brakes and transfer the patient to new position. Lower the patient carefully using the hand control or dual control panel. When the patient is seated in the new position, pull each cord up from the locking cleats and slacken the cords sufficiently to release the loop lock fitting. Then remove the cords from the sling. Detach the sling from the patient. Chassis caster brakes. The chassis rear casters have brakes, which can be foot-operated if required, for example when leaving the patient unattended, or to keep the Sara Plus in position. Battery. The battery is situated on the mast of the Sara Plus. A beeping sound and a low battery indicator light will flash when the battery needs charging. To ensure that the Sara Plus is always ready for use, it is recommended that a fully charged battery pack always be on hand. Do this by having additional battery packs available and keeping one charging while the other is in use. Display functions. Press the up arrow to raise the arcrest. Press the down arrow to lower the arcrest. Press the image of the spread legs to open the chassis legs. Press the image of the square legs to close the chassis legs. If pressure is released from any button during use, powered movement stops immediately. Battery discharge indicator. There is a small battery symbol on the bottom of the LCD. The battery symbol shows the level of battery charge. Hour cycle meter. The upper line of the display shows the total duration of lifting and lowering operation in hours. The display can also show the number of cycles by pressing the raise and lowering buttons at the same time. This is intended as an aid to help calculating the service intervals. Dual control panel. Sara Plus has a dual control panel positioned on the top of the main body of the lift. It offers the same controls as the handset. Emergency stop button. If, in an emergency, you have to immediately stop any powered movement, other than by releasing pressure on the button either on the handset or dual control panel, press the emergency stop button situated on the side of the cover. Once the emergency stop button has been operated, it must be reset by turning the red cap until it pops back out before any further powered movement can be utilized. Power on reset button. The green power on button is found on the rear of the case below the dual control panel. Press this button to turn on power to the lift. Power off button. The red power off button is found on the rear of the case below the dual control panel. Press this button to turn off power to the lift. System failure lower override. The system failure lower override can be used in the event of main control failure. It is possible to lower a patient supported in the lift in the unlikely event that the hand control and dual control panel fails to operate the lift. Use the lower override knob on the right-hand side of the main cover. A label is situated above the switch. Warning: before operating the lower override to lower a patient, always make sure that a chair or suitable support is underneath, ready to accept the patient. Cleaning and disinfection. For cleaning your lift, equipment and accessories, wipe down with a damp cloth using warm water to which a mild detergent has been added. To disinfect the device, clean the equipment first, then wipe it using a solution containing one of the compatible disinfectants referenced in the instructions for use. Disinfection methods should comply with the local or national guidelines.